Good day. It's Wednesday, May 6, 2026. From the gas pumps in Pretoria to the policy halls in Accra, the continent is responding to global shocks with a renewed push for local resilience. Here is your briefing. We start in South Africa, where commuters are waking up to a massive spike in fuel costs. With petrol up by over 3 rand and diesel by 6, the global oil crisis is hitting home hard. Driven by international tensions, this hike is a stark reminder.
My name is and unfortunately the upcoming hike is something we have to put up with because of the war. Hopefully the war will come to an end soon and we can all get to our life back to normal. Thank you.
Upetrol ngibona ukuthi kunyuka kwawo phela vele kuzosicindezela ngoba njengoba kuzoba upetrol icindezelela nabantu kunyuka zonke izinto ukudla kuhamba ngathi imoto ipetrol manje nje into ezosicindezela kunyuka upetrol mhlawumbe asazi noma khona uhulumeni icebo azolenza ukusilekelela
igama yami ngoMonamisi asobethi sibongo drive u-Uber mina lento kunyuka petrol izosilimaza ngempela mfethu kuzoba inkinga ngempela ngizokuthi uzonyuka ngo-8 rand lokho kuzobiza kakhulu upetrol since abantu abathatha ney'tawu kuzomele sikhokhe more kunalokho esikhokhayo manje ngolokhuzana ngopetrol. For example, le moto igcwala ngamalini ngo-800 futhi mase inyuke ngolokhuzana ngo-8 rand laba bathi uzonyuka ngawo kuzobe sekuyimalini uyigcwalisa kuzobe sekuza la ko-1.8 kuya ku-2,000 manje lapho umsebenzi esiwenzayo thina-ke imali ayinyukile khona.
Well, as compared to the international economy, we are just thinking that fuel price is going to affect the whole of the economy of the country. So like groceries and from groceries to everything, it's going to affect the whole lot of economical life of the country, and it's going to affect the normal person.
Petrol nezonyuka uzoaffectinga abantu abangasebenzi kuqala abasebenza amatoho bazo-affecteka. Ugavumenti ucela ayenze something ngalo petrol ezonyuka.
I'm part of the rush to fill up the tank today, and I had to leave my work to come and fill up because we rely on petrol nowadays, and also now you struggle to do both at work or be at work and also then have to break away to come and fill up. That's the problem at the moment.
And your petrol very, very, very painful and bad. Because in terms of Wednesday, it's affected negatively. Ndaba yama-price, indaba yokudla, ma-toll gates, yabo yonke nje service esiyithola from yabo. So yabo imagine ngiyacabanga ukuthi ufuna nofaka upetrol because ngifuna ukuya emakhaya. Yabo so ngufake before uzokhuphula, ngicela ngizogcwalisa before ukhuphula. Yabo lento yokunyuka petrol hayi yona iyabheka. Angifuni nje ukungayo. Sifila bad, very, very bad. Kade sixoxa yona nje lapha yabo singo-driver sizophazamiseka, ama-passenger azophazamiseka, abagibela amateksi, abagibela u-Uber, abagibela nje into esebenzisa ufuel kuzosho kuzoba bad, very, very bad.
Of the continent's exposure to external energy shocks and the growing urgency for domestic refining capacity, in West and Central Africa, a different kind of shield is being built. The new Fit to Prosper strategy launched in Accra isn't just about medicine. It's about economic survival by aiming to protect 200 million people from preventable disease. Without bankrupting their families, African leaders are betting that health sovereignty is the true foundation of future job growth.
to the World Bank, countries which invested in health security following the 2024 to 2026 Ebola outbreak fared better during COVID-19. Subsequent assessments has, however, indicated weakness in preparedness to detect and respond to health emergencies. The situation usually cripples the development of a country if not readily addressed. That is why they are pumping funds to aid some countries in Western and Central Africa to fix the issue affecting primary health care. Here is Vice President for People at the World Bank Group, Manta Mrati.
We're talking about service-ready facilities which have electricity, they have water, and very importantly, they have digital connectivity. That's number one. Number two, we're talking about diversified delivery platforms so that people can be reached wherever they are. And that means not just primary healthcare facilities, but reached through community health workers, reached through telemedicine, reached through schools. Third, we're talking about an expanded and a digitally enabled health workforce, because that is at the core of primary health care. Fourth, we're talking about service packages that are designed around each country's own domestic burden, not external financing priorities. This has been a bit of a reset that is being called for in the global health architecture. Fifth, we're talking about sustainable domestic financing because this is about taking responsibility for the health of one's own population. And sixth, and this is not to minimize the importance of this, we're talking about reliable access to affordable medicines, vaccines, diagnostics, and supplies.
Chief of Staff Julius Debra charged African countries to ensure the strategies are implemented.
No country can achieve health security alone. Diseases do not respect borders, and neither should our solutions be safe. The World Bank's regional strategy rightly emphasizes cooperation, knowledge sharing, and joint action. Ghana stands ready to play its part. We will continue to strengthen regional surveillance and emergency response systems, support local manufacturing of health products, and promote the exchange of knowledge and innovation across our region.
Inferring to the strain the withdrawal of donor funds had on health services in Ghana, the sector minister, Kwabena Mintah Kando, emphasized the country's quest to invest in domestic health financing.
Ghana is willing and ready to invest domestically in where we need or where it's needed most. The uncapping of the national health insurance, where all the monies realized from the national health insurance levy is being invested in the health sector. Already, we are even exiting from some of this program. Gavi, they support us with a lot of our vaccines, but we are exiting. Last year, for example, our budget for the vaccines stood around $24 million. We had the money to invest in it. This year, our budget is around $49 million. We are investing in it because it's public good.
CEO of the Komfanochi Teaching Hospital, Dr. Kweju Saben, commended the inputs by the World Bank, emphasizing how effective they will be employed to boost healthcare delivery.
So without the data, it's like we'll be walking in the dark, trying to find our way out of it without much success, because we need to set objectives, and setting these objectives depends on what happens on the ground. So if you know that 12 women, for instance, die every month in a particular region because of pregnancy-related issues, you are able to tell that, let's say, 7 of them die from hypertension-related issues, 5 of them from bleeding. In that case, we'll need to put in measures that will reduce the incidence of hypertension, and those who get hypertension can receive the necessary support so they will not die. If you take bleeding, in pregnancy, then we can make sure that there's blood banks available. And then when women find themselves in emergencies, they can be conveyed to the nearest facility where they can get help. And then also to even increase the number of facilities where these women can be taken care of.
And in Abuja, Nigeria has officially become the nerve center for continental road safety by hosting the joint secretariats for West and Greater Africa's road safety agencies. The nation is positioning itself as a leader in sustainable mobility, proving that saving lives on our highways requires a unified, African-led approach. Global pressures, regional solutions, and a continent finding its stride. I'm Kelvin, and that is your essential update for today. Stay safe and stay informed.
Your presence here in Nigeria is a testimony to our shared vision, commitment, and the enduring bonds that unite us as brothers in Africa. On behalf of the Federal Government of Nigeria and the Federal Road Safety Corps, I warmly welcome you to our country and wish you a pleasant and memorable stay. I also warmly welcome our esteemed Nigerian guests and valued critical stakeholders in the transport and safety sectors.
I want to express my sincere appreciation to the World Bank and to SSATP for its unwavering support to Ursula and to road safety initiatives across the continent. And lastly, I want to warmly congratulate Nigeria for hosting the General Secretariat of Ursula and extend our deep gratitude for offering the continent the facilities that we're inaugurating today.
Distinguished ladies and gentlemen, this inauguration marks the beginning of a renewed collective African effort to reduce road traffic deaths and build safer transport systems.
To our host, the Federal Republic of Nigeria, and to the FIRC, we say thank you. Today, Abuja becomes the capital of our collective resolve to save lives on our roads, keep dreams alive, and ensure Africa's sustainable development goals are achievable.